Good morning, guys. I hope we're all sparkly. Today we're going to talk about post-finasteride syndrome. Fact or fiction? Disappointingly, I can assure you it's fact. We have lots of guys present to the clinic with symptoms of PFS and lots of guys wanting screening DHT blood tests, not realizing that DHT is a paracrine hormone, so blood levels are pretty much irrelevant. Post-finasteride syndrome, what is it? Well, it's troublesome symptoms that persist after cessation of finasteride, this drug that's used for treating male pattern baldness. Not realizing that male pattern baldness is genetic and has an epigenetic component. So why would you bother? Why would you bother wanting to preserve your hair if you knew it was going to go, and if you knew treating it was going to cause you troublesome side effects that are often intractable? Well, because you listen to the internet. People telling you that it's incredibly rare. But anybody that says PFS is rare and not much of a problem has a vested interest in you taking finasteride. I have a vested interest in looking after you guys and making sure I treat you with respect and integrity and have an ethical code to do right by you. And I would never, ever recommend finasteride for male pattern baldness. It is used for treating benign prostatic hypertrophy, but my days in that sort of medicine are long gone. So every drug has benefits and risks, and for me, finasteride has way too many risks and not enough benefits. So we're going to go back to basics. We're going to go back to basic physiology. Testosterone converts into dihydrotestosterone, and it does that via the 5-alpha reductase enzyme. And what's finasteride? Yeah, a 5-alpha reductase inhibitor. What else? The neurosteroidal pathway. Progesterone converts into allopregnanolone, and it does that via the 5-alpha reductase enzyme. That eventually cascades to GABA A, and that's a calming neurotransmitter. So you can see where this is going. Post-finasteride syndrome. Inhibition of 5-alpha reductase is going to cause psychological problems and problems down there. So these guys often have an intractable anxiety, memory disturbance, low libido, and genitalia dysfunction. It is not pleasant. It is utterly horrendous for some of these guys. And I do feel really sorry for them because they've been sold a lie by these guys wanting to sell you on the concept that just take this drug, minimal side effects, and everybody that's got PFS is crazy. That's simply not the case. We're not all wonderfully well balanced. We all have little niggles in our brain, and disappointingly, if you mess around with DHT, which has a calming effect on the brain, GABA A, as we've said, has a calming effect on the brain, you can sometimes have this intractable anxiety which makes everything worse. And as I've said before, we're physical beings in a world of psychological stress, and if you can't deal with the psychological stress because you've got brain dysregulation through hormone dysregulation and neurotransmitter dysregulation, my word, you are fighting an uphill battle. I would not wish PFS on my worst enemy. Because we want DHT. We want DHT because it's a potent androgen. It's more potent than testosterone. It's involved in increased muscle contraction. It's involved in development of your genitalia, the hair on your chest, your pubic hair. It is a potent androgen. So we want to have hormonal balance, realizing that all hormones are dependent, whether that relationship be direct or indirect. All hormones are dependent, and we need balance within the body to maintain homeostasis, this complex process that maintains a stable internal environment despite external changes. Give your body the best chance of doing right by you so that you can lead a healthy, productive life. Now, if you're worried about your hair, look after your stress, look after your sleep, look after your nutrition, making sure it's rich in micronutrients and exercise regularly. If you're super worried and you want something else to do, you can potentially take minoxidil, which is a vasodilator, but make sure again you haven't got any cardiovascular problems, and make sure you run this by your doctor who's aware of your personal medical history, because all drugs have benefits and risks. So finasteride was obviously primarily for benign prostatic hypertrophy, because DHT, alongside the muscles and the hair and the genitalia, it helps prostate growth, but in excess causes prostatic hypertrophy, which then causes negative symptoms, urine symptoms such as going for a pee a lot, getting up at night time, etc. So what else? How do we treat these guys with post-finasteride syndrome? I'm not going to lie, it's difficult. Why is it difficult? Well, causation is difficult. We can't measure GABA A, and anything in excess is bad for you, even GABA A, even DHT. We've got association between excess DHT and cardiovascular problems, so we don't want anything in excess. So what do we do with these guys? Well, we do a blood test, and if they have a confirmed testosterone deficiency, we can prescribe them TRT, testosterone and HCG. What's the most important component of this protocol? Well, you might realize that HCG would be pretty useful in this situation. Well, why is that? Now, HCG mimics luteinizing hormone, so it's going to help preserve testicular function and production of testosterone within the testicles, and then you get exposure to 5-alpha reductase around the prostate, so that makes sense. HCG also has a positive effect on brain function. Why? Well, there are LH receptors in the brain, so if you have HCG in your protocol, you're going to hopefully stimulate the neurosteroidal pathways, and as we've just said, 5-alpha reductase is involved in the conversion of progesterone to allopregnanolone, which then again cascades down to GABA A. So we are trying to replicate the hormones through HRT, which is testosterone and HCG. What else can you potentially use? Well, you could potentially use Proviron. Proviron is a DHT derivative. Now, it doesn't cross into the muscles, and again, you can't really titrate the dose according to effect. And our experience with Proviron in TRT has been overwhelmingly negative, really, because unfortunately you will see a temporary improvement, because what is it? Well, it's a DHT derivative, and as we said, we want DHT because we've obviously just lost DHT from preventing it from being converted from testosterone with the 5-alpha reductase inhibitor. But it also binds to SHBG, so you get a slight temporary increase in testosterone, and then the SHBG essentially drops, and then the buffer effect of the SHBG causes negative symptoms. So as I said before, SHBG being my favorite glycoprotein, we want a healthy level for a healthy ratio of DHT to testosterone to estradiol. So on paper, Proviron sounds great. In practice, disappointingly, it's disappointing. So all I would say really for post-finasteride syndrome is please do not take finasteride. If you do have symptoms, then yeah, we can try and help, but the treatment isn't always effective, and I wouldn't wish this on my worst enemy. So let's end on a positive. We have had some success with treating PFS with testosterone and HCG. And I think one of the things is, number one, trusting the process and having the right mindset. Work with what you've got and build upon foundations to be the best version of yourself. To do what? Yeah, go earn your reward, guys.